I'm chair of the Health, Social Care and Social Inclusion Policy and Accountability Committee, and my professional address is also
And if you look in the bundle in front of you at volume 1, pages 9 to 20, you should find the submission which I've prepared. But can I ask one of you to indicate whether that submission is true and accurate to the best of your knowledge and understanding, and if you wish to stand to evidence of the Commission?
Yes, it is, and yes, we do.
I wanted to ask you first about some matters you raised in terms of assumptions. Paragraph 2.3 on page 10, in your opening paragraph, you talk about the modified business case being based on some unrealistic assumptions. And you talk later on in paragraph 3.1 about over-provision of A&Es, and then about the population issue. Can you help us with what you say the assumptions are that have been relied upon and how they may be in error if they are not correct?
Yes, and my colleague will add to this. The assumptions were that they would make significant headway on treating the greater number of people in the community, and that would be able to reduce the amount of demand for A&E, and that tied in with improvements in GP services as well as adult social care as the Commission's already had. So they're the assumptions, and they're flawed for a number of reasons that we can go into, but not least because they're based on a variety of incorrect information. So if you take population figures were primarily done by the Office of National Statistics analysis, which occurred some time ago, mostly based around the last census, and it was topped up with extra information from the GLA, but actually what it does not take into account is that there is a £35 billion development happening in College Park and Old Oak, which will add at least 70,000 population. There is a £12 billion development taking place on Earls Court, which will add well over 10,000 in population. And indeed, we are in talks with GLA of sinking the gyrators, sinking the Hammersmith flyover, and replacing that with housing and a park, as well as TfL opened up talks about the Hammersmith gyratory. So a significant development will be happening in the centre of Hammersmith, which will add significant extra population. None of that has been taken into account in shaping up the future.
Could you also just clarify whether in addition to the future population, whether you say the figures for the existing population are correct or incorrect?
Well, we believe the figures are inaccurate to detail in our documents. And whilst we don't know that's deliberately so, it certainly is the case that relying on the ONS figures does seem to be unwise and possibly a touch reckless, given that they are so out of date and London is such a fast-changing city when it comes to population.
Now, if the assumptions are flawed, what effect does that have on the business case for reconfiguration?
Well, we appreciate making such assumptions are difficult, but it's certainly the case that if you've drastically underestimated the population and you've underestimated the traffic, then the figures they have on, for example, taking someone from Fulham Reach Ward, which is the ward Charing Cross Hospital is currently in, and driving them at blue light to St Mary's within, they argue, 14 minutes. And that clearly is difficult on traffic alone. The fact that they then argue that the A&E at St Mary's will be fit for purpose with this increased population going through St Mary's, then I believe the calculations on the number of consultants, number of acute care beds needed, all of that does not marry to the size of the population. I don't know if my colleagues would like to add anything.
I wanted to turn to the issues in terms of the acute A&E situation and start first with Hammersmith Hospital. Now, your submission sets out that the closure has had a severe impact. Can you provide any further details of the very up-to-date position in relation to, first of all, waiting times, number of patients being sent on to other accident and emergencies, and journey times?
Yes.